Hi, I'm Kit Gorton. In my video about population health management, I shared some of what I've learned in my career as a pediatrician and health plan CEO. Today, I will extend that discussion to talk about managing financial risk in healthcare. I will start by reviewing a definition of risk, and then break down how purchasers, payers, providers, and patients share different types of risk. I'll conclude by discussing the ways these different decision makers can effectively manage the risk they experience. So what is risk? Put simply, it's the probability and the size of the possibility that something unexpected will happen. Human beings are natural risk assessors, and we learn early how to do it. You probably have early memories of your parents saying, "Don't do that, it's dangerous." Risk assessment is important for survival and for getting the most out of life. In healthcare, there are several types of risk. First, the risk of death, disease, or disability, which arises from genetic, environmental, and behavioral factors and impacts patients and their families. Next, the risk of complications, which arises from exposure to procedures, medications, and therapies. Please keep in mind that no treatment or test is 100% safe. This type of risk also impacts patients and their families. And finally, financial risk, which arises from the cost of care for a person or group of people over a period of time. If the costs exceed the funds that are budgeted and available for that time period, then financial losses may occur. When an individual has health insurance coverage, the risk of these losses is spread among purchasers, payers, providers, and patients. It's important to recognize, though, that financial risk is not shared equally. The purchasers of insurance, usually governments, employers, and the individuals themselves, determine what the annual healthcare budget is and what benefits can be purchased with that budget. Payers, that's the insurance companies and health plans, determine how much they are able to pay providers and still retain sufficient funds to administer the benefits and build reserves. Providers determine what care they will provide and what it costs to do so. Patients pay their share of premiums as well as out-of-pocket cost sharing. In addition, patients pay for the cost of care which is not covered by insurance. Now, I'd like to examine each of these domains of risk in a little more detail. Starting with the purchaser domain, governments and employers decide what benefits they will offer coverage for and how much they are willing and able to contribute to the payments for those benefits. That decision determines how much the individual patient will need to spend to access care. Sometimes the purchasers offer a choice of coverage options at different price points, and the patients, knowing their own typical use patterns, choose the best option for their particular circumstances. The risk for purchasers is that patients will be dissatisfied with the options available, or that increases in the cost of care over time may make some coverage options unaffordable in future years. Moving to the payer domain, the insurance companies and health plans play a major role in the business of risk. They oversee the budgets for different types of coverage and must determine what premiums and cost sharing will be required to provide sufficient resources to purchase care for the insured population during the upcoming coverage period. I've included a very simplified formula on this slide so you can see some of the factors that actuaries consider in underwriting calculations for premiums and cost sharing. Payers also perform the important function of pooling risk across larger populations. These larger risk pools are less expensive overall and are more likely to have sufficient resources over time to purchase care. Sometimes it is not possible for payers to establish a premium level for coverage that is both affordable for patients and adequate to cover the expected cost of care. In those situations, payers may employ population health programs to reduce disease risk and expense. They may actively manage utilization, that's the technical term for the amount and duration of care, by imposing quantity limits and prior authorization requirements. Health plans may restrict access to more expensive providers and promote limited networks that are more cost efficient. They may exclude coverage for costly and unproven care, or they may choose not to cover some people or groups. Even if they use some or all of these tools, payers still risk having a sicker population than they anticipated or a population that uses a more expensive mix of services than was budgeted. The healthcare provider domain in the United States delivers over $3 trillion worth of care every year. The bulk of these expenses come from hospital care, physician and clinical services, and prescription drugs. Providers are responsible to design, assemble, and manage the people, facilities, processes, and materials necessary to deliver a broad array of health care. They are responsible for recommending which care should be rendered and to which patients. Finally, they determine what they will charge for services and what types of payments they will accept. In most cases, however, purchasers and payers will place limits on what payments are allowed, so providers are paid less than their established charges. Unless properly managed, this can result in providers being paid less than their actual costs to deliver the services rendered. Alternatively, high provider payment levels may result in patients being unable to afford the care which has been recommended, and which may lead to patients migrating to less expensive providers. In the end, it all comes back to the patient domain because healthcare is fundamentally personal. Patients and their families sometimes make hard choices to balance the risk of death, disease, and disability with the risk of complications and the financial risks of consuming healthcare. I'd like to finish up by briefly reviewing how financial risk can be managed effectively in each of the 4 domains. Purchasers can manage risk by limiting their exposure. They cap their expenditures, limit benefits and options, and shift costs to patients. Payers can use specialized actuarial techniques in their premium underwriting to establish sufficient annual budgets to purchase care. They can employ population health programs and pool populations to minimize risk from high-needs members. They maintain reserves to enable good years to offset bad years. Providers can spread risk by balancing the mix of payment types they are willing to accept. Cost shifting between payers enables providers to still serve patients with less generous forms of payment. Providers also have a variety of mechanisms they can use to control the actual costs of service delivery. Finally, patients can manage risk by choosing coverage that they can afford and that they expect to meet their needs. They can be prudent in choosing which care they consume and in choosing their providers. They can use self-management tools for wellness and the prevention of serious illness to minimize their need for expensive healthcare services over time. As you can see, managing financial risk in healthcare requires understanding how risks are shared and making choices that suit individual circumstances. I hope you found this video informative and useful. That concludes my discussion on managing financial risk in healthcare. Thank you for watching.